dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and this is Dr. Laura Chan and Dr. Margarita Ochemaya. We're delighted that you're with us today. And today we're going to be talking about the consequences of unhealthy weight. And you know, we had a listener who sent in a question to us, and the question was, are sumo wrestlers really healthy? So perhaps you could follow up with that, because they are really big. These people weigh like 500, 600 pounds, right? The more the weight they have, the better.
That's right.
So maybe you can clarify that, because there was a misunderstanding related to that.
I think it's not necessarily the whole concept of weight, because they are not. They are obese, and they are very, very, very big. The consequence when addressing the sumo wrestler concept is more that their fat to muscle ratio is difficult to calculate because it's within their muscle. So they're very, very big, but they have an incredible amount of muscle, reason for which they're very strong. But when a muscle has a lot of fat within itself, making the person very, very big, and it looks as if they were defined, those are very, very big people. They are sometimes the bouncers or the bodyguards or people who are always at the gym. And so we can't really classify them as extremely unhealthy. But what happens is that when they're so big and the muscle has so much fat within itself, it becomes very toxic. And it becomes very resistant to the hormone called insulin. And that's where the diabetes comes into play. So when somebody is very, very big, and in this case, the sumo is a little bit of a special category. Yeah. But again, they're very, very muscular. They pretty much fast all day and gorge all night. But during the day when they are fasting, they're being extremely physical. So they have a technique by which they're trying to make that muscle fatty.
But it's not healthy for them.
No. It's
I can
not
imagine.
healthy.
Yeah, I wonder what they're
very high risk of diabetes in that subgroup.
And how early they may die, also related to their health and well-being, because they are big people. But this brings us right into overweight. What are the types of diseases that come from being overweight?
That is a good foray into being overweight and the diseases. So the diseases related with obesity are the main chronic diseases that are the biggest causes of health concerns in developed countries. These chronic illnesses including heart disease, diabetes, even cancer. Cancer can be attributed, directly correlated with obesity. And not every cancer, certain cancers. Arthritis, so a lot of people who are very overweight will have joint pain. Even depression and quality of life are considered to be directly affected by obesity.
So can we talk a little further about obesity and disease and go one disease at a time? Related to heart disease, how can obesity affect heart disease?
So obesity is, I think, the root of the problem for many, many problems. And I'd like to add one more with this, which is our social problem and the stigma of obesity. But when going specifically to how the word being heavy and being abnormally heavy for your health, which is the word obesity, I think what it is that you end up having high cholesterol. And high cholesterol still needs to be mobilized around your body, and it starts depositing cholesterol products around your blood vessels. And then therefore, one of those cholesterol products can then break loose and lodge itself down the path in a thinner blood vessel, causing a heart attack, causing a stroke. And these are preventable if we manage our weight, if we manage our cholesterol. And it's a whole topic in its own self, but at the same time, being overweight to the point that you are obese has a very high correlation with heart disease by virtue of likely the high cholesterol, inflammation, and situations with your blood chemistry.
Now, more related to cholesterol.
Right.
What are the numbers of high and what's normal? How does one know?
Right. So in the United States, we've marked the number 200 to be above 200 for total cholesterol. I know in European countries they have a little bit of a higher number that they consider.
But there's good
unhealthy.
cholesterol and there's bad,
Yes.
right?
So there are two types of cholesterol, and one way that I'll tell my patients as a simplified way to describe it, we have the LDL cholesterol, and I tell them remember L for lousy, and the HDL cholesterol, and I say remember H for healthy. And to really simplify it, the LDL comes and it deposits the cholesterol, or it deposits things in your blood vessels, and the HDL comes and moves it away. So the LDL is like the dump truck dumping things in your blood vessels, and the HDL is like the snowplow that comes and clears the vessels out. So I like to describe it that way, keep it really simple, use that analogy to say, that's kind of what's happening in your blood vessels. And when that ratio is off, when you don't have enough of the healthy one to clear things away, and you have a little too much of the lousy, you get a buildup in the blood vessels, and it can lead to heart disease, heart attacks, strokes, like Margarita was saying.
Now, Margarita, it was interesting because you said overweight. There's a portion that's overweight, and then there's a portion that you're much overweight, and it can be termed as obesity. What is normal weight?
So yes,
What becomes overweight, and what are the stages, so people know?
right. We discussed that in our previous show as well. So BMI is still standard to kind of classify weight problems. So a BMI under 18 is an extremely unhealthy low weight. Then we have a category in the middle.
This is for adults.
This is for adults, correct. That's very important, yes. Then we have a BMI that goes from the 19 to 27. I think a healthy weight is if your BMI is between 20 and 25. But in the books, really, at 27, we have the cutoff for overweight. At a BMI of 30 and above, we then have obesity. And then we just classify it in several degrees. So 30 to 40 has one, like class 1, 40 to 50, class 2, and over 50, class 3.
And the classes mean what related
They're
to
really
health and
more
well-being?
for us to understand the severity of risks and associated medical problems. And also because when we are looking at, what interventions are more urgent. So when we have a child, in this case, who has a BMI for a person that is an adult, for example, and now his weight, now we have to calculate it according to even adult numbers, and BMI is height to weight. So if a child has a BMI greater than 40, likely they will possibly recommend a program. There are in-house programs that you actually are in the hospital for, and there are outpatient programs, and then of course there's weight management programs. So in terms of classification, it's more for insurances and or the ability to understand risk.
And also just to track populations in general, so we can see, is the trends in the United States, are we getting more people in a certain class of obesity? Are things getting better? Are things getting worse? Not looking so much on the individual level, but as the whole population. And, in the United States, we've seen that for both children and adults, the obesity rates are tremendously increasing. I think the number is that almost a third of adults are considered to be obese or overweight.
So what are the symptoms that people from a heart basis that are overweight, what would be the symptoms that they would present with that would be obvious for them to know?
High blood pressure.
High blood pressure. What else?
We'll start with even physical deconditioning. The lack of desire to go out and feeling tired and maybe getting a little short of breath with the least amount of effort.
Exactly.
And that means that your body is really not
Working hard
doing
to
well.
try to do
Right.
whatever it needs to
And
do.
then, of course, the home blood pressure kits. Or sometimes at the pharmacies, you can have a blood pressure check. You can visit your nurse and have a blood pressure check. And so the blood pressure, when it starts getting off, now the system's under a lot of pressure.
And a normal blood pressure would be?
120 over 80.
120 over 80 is a good blood sugar. And does that go all the way through the years as one ages?
It's not accurate for children, but
Not
for
accurate
adults.
for children, accurate.
Yes.
So now let's move on to diabetes. So when we're overweight, how does it present where there would be certain symptoms that people would need to be aware of that it could be leading them down the road of diabetes?
Okay, so diabetes presents in people in many multiple ways. Some might just not have noticed that they're drinking unbelievable amounts of fluid. And unfortunately, some are drinking like orange juice or apple juice, which is only making the problem worse. But an extreme amount of thirst going through gallons and gallons of liquid, which then, of course, as you're going through gallons of liquids, then you're going to the bathroom quite frequently. That is the landmark presentation for diabetes. And I think all our viewers should look into, if they're having a frequent thirst and urination, definitely should look at the doctor, call a provider and address that.
You know, I also am aware of a situation that it's important to with your adolescents and younger children, that they may be drinking a lot of water in the evening and not telling you. So it's important to be aware also, if they're drinking a lot of water or things are changing, that there may be something going on with them that they haven't communicated. Any other things related to diabetes and overweight that you'd like to kind of jump in on?
Well, one point I'd like to make is that you don't necessarily have to be overweight to develop diabetes. I think it's important that people remember that. But you're much more likely to develop it if you are overweight or obese.
Okay. Well, then
I can
was
add
there
a couple more
please.
for the diabetes
Okay.
because they're important, I think really important for our viewers. Actually, 30% do not have any complaints whatsoever. It's a random check at a laboratory for some other reason. It might be for employment reasons, or yes, your routine physical, and all of a sudden the number came back high. But in those that are presenting symptoms, it could be frequent yeast infections for women. It could be a common sinusitis that will not get better. It might be that you actually present with a heart attack. And a lot of data that is well substantiated by articles in the medical literature say that there's a high percentage of people who come into the emergency room with a heart attack have diabetes and did not know it. Because it's a problem. You might not know you're having this diabetes situation.
All right then. Well, let's move on to cancer. How can being overweight, come out as symptoms that could be leading to cancer?
Well, so one mechanism where we think that obesity is contributing to cancer is because with obesity there can be a higher level of inflammation in the body.
Let me ask you, is it obesity being over, or can just being overweight begin the process of...
It can begin the process. Again, in the last show we talked about abdominal fat.
Yes.
And we know that the abdominal fat, that particular type of fat, which is different than the subcutaneous fat that we might have on our arms and around our hips and on our legs, the abdominal fat is more inflammatory. And so when we have more of that, which most people who are overweight or obese, they have bigger bellies typically, that causes more inflammation in the system. And inflammation can contribute more to heart disease, which we had already mentioned, and also can contribute more to cancer
What
as well.
types of cancer?
So what happens is our fat tissue is no longer like a bank of energy, or if you eat too much, that's where it all goes. It happens to be that the fat tissue is like an organ, and it communicates and sends out those inflammation markers that make you hurt, and then if you grab your arms, they hurt. And so there's just a generalized painful sensation. But what ends up also happening is that they store hormones. And the number one associated with being overweight is breast cancer.
And endometrial cancer,
Right.
testicular
being
cancer
overweight.
in men. So
Isn't that interesting? So
some-
then again, it's important that the viewers realize that they can do something about this
Right.
related to their health and well-being.
And pancreatic cancer
And
also.
pancreatic cancer.
Yes.
And so the symptoms that may come up for them from a cancer point of view by being overweight?
You might not know.
You
Again,
might
that
not
goes
know.
very dangerously is the fact that you might have up to 5 years of not knowing you had type 2 diabetes and then end up having it, but have had it like for 5 years and not have done anything about it. And with cancer, we know it's the silent killer because unless you're going to your provider, unless you're doing your regular checkups, unless for women they are doing their breast exams, you know, there are circumstances by the time we start feeling things about the cancer, it might be
Some signs that you
away.
really wouldn't want to ignore would be fatigue that you just can't explain any other way,
Yes.
night sweats that you can't explain for any other reason.
unless you're going through menopause.
Right, in which case you want to make sure it is menopause
Right.
and it's not something else contributing to it. Or unusual bleeding, so a woman might be done with menopause and then years
of a
later have
sudden.
unexpected bleeding.
Okay.
One other one is actually sudden and unnecessary or no reason to explain why you're losing weight and you're continuing
So
to
weight
lose
loss.
weight.
Right.
So
Yes.
now here we're talking about, you know, being heavy, but when we start losing weight precipitously as adults, there's something wrong. Your body's telling you something.
Absolutely. It's a signal. It's a red flag to pay attention to.
Being underweight is not good.
Yeah. It's really important for people to recognize the red flags that their bodies tell them. A lot of times they see certain things, feel, but because of fear or they're so busy, they go, I'll ignore it. And then they get this other bigger red flag and then the real big one. So it's important. Now let's talk about arthritis. How
Right.
can being overweight affect arthritis?
It's very mechanical, really. Just carrying around more mass really stresses the joints. If you can imagine someone of a healthy weights, if they were to put on a really heavy backpack and go hike up and down mountains, they might have some sore knees the next day, sore ankles, sore hips. Essentially, being very overweight is like you're carrying a big load, a big burden, so it just very mechanically stresses the joints.
How about your thoughts?
I think inflammation. Again, back to these inflammatory markers where our body starts being a little toxic and feeling kind of difficulty in removing certain toxins, they accumulate in the joints and create a lot of inflammation now specific to
great point.
areas. Yeah.
So let's go to too thin. Explain to our viewers about anorexia. What is anorexia and what is it being too thin, and what are the symptoms that people should be aware of where it's going down that road?
Sure. So, well, first of all, we focus so much in this country and in society on not wanting to be too fat that I think being too thin can sometimes fly under the radar. And
Right.
that's a big concern because being too thin can be very unhealthy as well. So anorexia is one of the more common, what we call pathological or problematic instances of being too thin. And that's a situation where someone typically has a lot of fear about calorie consumption, so there's definitely some emotional overlay with it. And there's intentional calorie restriction to the point of keeping one's body weight down. And it can be a very difficult situation to treat because you need to treat both the physical and then some of the complicated emotional pieces.
And it
with
can start very young, too.
Extremely.
So what would be the symptoms that people should be aware of, or the signs if all of a sudden it's
An
going towards
extremely thin individual, and in this case more when a person is thin but they do not perceive themselves as thin.
Right.
And they're continuously thinking that they're heavy.
Yes.
And so I think it's very important to know that there's an amazing amount of knowledge actually that we're getting from more research with regards to the brain hormones.
Yes.
Because there are some brain hormones that are directly feeding into appetite. So as much as we are always worried about what's going on in the mind, and I always blame the media is not the healthiest to help our young people and even older people for that matter, look at their body image and then be happy and content with that. And then understand that too thin is also not good. But then there's also the bulimia.
Yes.
Because it goes again to these kind of love-hate relationships with food.
Let's talk about what is bulimia. What happens when someone...
Okay, so then what happens is they overeat
Yeah.
and they cannot stop eating until a certain point.
Yeah,
And then the anorexia bulimia is that then they would end up eating and then trying to mechanically bring
Throw
back
up.
the food.
Yeah.
Yes. Yes, it's a very sad situation because there's usually a pretty significant depression and anxiety and other mental conditions that really could be treated, you know?
Now, a sign of that may be, if you're eating dinner and somebody's enjoying dinner with you or whatever else, if you happen to notice, or some meals, that they immediately leave right after they finish eating.
Or they're cutting their portions and they're just playing with their food and only consuming maybe a third of it, particularly having it would be an unhealthy relationship with the food.
Or sometimes overuse of laxatives, if someone's intentionally using laxatives in that regard, along those lines. And going back to anorexia, when people are really hyper-focused on their calorie intake and you hear them, weighing their foods and knowing exactly how many calories they've consumed, then sometimes you might want to check in and raise some awareness around that.
You'll also see some athletes kind of really up their training
Yes.
and really go, in a sense, to an extreme where they're really pushing it.
Right.
So I think it's all about balance.
That's it.
So for athletes, for example, energy in, energy out.
Right.
And so if they're consuming more energy by their exercise and fitness than they are consuming as in the terms of food,
Yeah.
that energy balance puts it in a net loss.
Right.
And so it's called the eating disorder of the athlete.
Yes.
And in this case, the number one situation is that they actually, girls would actually leave their period. No more menstruation, no more normal cycling. And then, of course, that causes osteoporosis, and some athletes might even have some fractures because of overuse.
I totally agree with you. I think balance really is the key, and sometimes a little bit challenging to achieve. And there's actually another eating disorder that's more recently described, and it's called orthorexia.
Yes.
And it's a situation where someone is fearful about eating something that's not healthy. So they're so hyper-focused on being healthy that they're afraid to eat something that they might not consider healthy.
Especially if there's no other choices.
And so with all of these, whether it's the athletes or whether it's a bulimic or anorexic or this orthorexic, it's really when there's fear-based eating that there's a problem. When we're not feeling nourished by the food that we take in or not feeling comfortable, when there's a lot of stress and a lot of fear around eating. And you might be eating the healthiest foods out there, but if you're doing so with a lot of fear, then it's really quite problematic.
Because that has an emotional response to the body and affects all levels within it.
Absolutely. There's so many hormones, and there are so many dimensions when it comes to eating and exercising and being healthy. And that balance is very important, like in terms of the fat to muscle ratio, if it's waist to hip ratio, if it's measurements, if it's the scale. And even when we look at it within subgroups of our people, so Hispanics tend to have a significant amount of weight problems more towards obesity. And we just have to look at it in terms of how culturally, personally, spiritually, as well as how much we know about what's going on in our body.
Plus, families. You can see in families. You know, you can literally look in generations of families where the people may have been bigger, or they may have been tinier, smaller.
Well, but I have something to say about that, because
Please.
usually what we do as a community, what we do socially, is we eat together.
That's
Right.
it.
And so usually that is a means by which a family can communicate.
It's true.
And
Right.
so it's very, very important to find out who's the one who's doing the shopping, the food shopping, who's the cooking, who's doing the cooking. What are we doing when you're making the meal, and then are you all having a meal together or separate? And then really all relates to, are we also going to be doing some activities together? And I know we've always been saying that in the theme of our shows.
Absolutely. So when we talk about too thin, how does that affect one's longevity in life?
So too thin can be just as problematic and sometimes more problematic than too heavy. So one big thing that can happen, Margarita already mentioned it, is osteoporosis, and that's due to hormonal changes. When you get a low estrogen state, which can happen when you're too thin. And you can explain this even more, but essentially our fat cells help produce estrogen, especially for menopausal women who her ovaries are no longer actively producing estrogen as much. That's when the fat cells can do so. And so if someone doesn't have a lot of fat cells, especially a very thin older woman, that can really contribute to osteoporosis because estrogen is involved in bone metabolism.
And of course, that's why as one ages with that lack and they're falling, there are more breakages.
Yes.
And the
Hips,
bone quality.
Their
So
bone quality changes.
you mentioned in terms of losing weight, but also there's a mechanical concept, because in this case, if you were to fall, the muscle acts as a cushion.
Exactly.
And so if you're really thin, you
have
fall.
no padding.
There's no padding.
Yeah.
No padding at all.
Right.
So it's good to have a little padding.
It's necessary.
Padding is necessary, so that's very important. Okay, so as a summary, we've talked about, what about immunity, related to immunity as such?
Right, so when someone is calorie restricting, when we were going back to the eating disorders, they might not be getting enough nutrients coming in, and our immune system is so dependent on nutrient status that if someone is calorie restricting, then it can significantly affect your immune system in that way. And so when your immune system is affected, you're more likely to get colds and flus, but then even conditions like cancer, because our immune system is always on surveillance and clearing out cancer cells that are present all the time, but ideally your immune system is clearing them.
I would agree with you, Laura.
So It's so critical. I mean, we really can be empowered to make the choices that we need to really take good care of ourselves. And an amazing thing as we go through this discussion is every time it comes down to what we eat.
Right, and how we eat. I really think it's so important that we eat our food to nourish ourselves and that we don't have fear-based eating.
Right.
When I'm educating people about changing their diets, I always want to check in and make sure, this shouldn't be fear-inducing for you.
Right.
You should be able to make these changes with love and to really nourish yourself and enjoy what you're eating. It's so important that we don't have fear-based or anxiety-based eating.
It's very, very true. As a summary, what would we want our audience to know, to remember related to this discussion?
I think a healthy weight is ideal, and a healthy weight is premised on balance. You feel good about yourself, you have happiness, and you relate well with your mirror. Start there, that you're okay with the scale, you're able to do your activities, no fatigue.
Right.
And very importantly, those that are underweight and or are overweight, the first part is awareness with love and compassion, and then trying to thread out where it is that you can seek help and do so. Because by doing so, you can prevent so many more other problems.
Absolutely.
That's where I think is the...
How about you, Laura?
And to know you're not alone. There's so many people who deal with low self-esteem around their weight, whether it be too high and they're wanting to lose weight, or they might be severely underweight because of a self-esteem issue. And so it's important for people to know they're not alone and that there are a lot of resources available to help, whether you're underweight or overweight.
I would encourage anybody under or overweight, no matter what the weight is, make sure you take excellent care of yourself, even related to your body image of taking showers, washing, pricking yourself up with colors, get clothes that look good on you. Even though your size may be big, it doesn't matter. You can still look great.
Absolutely.
Right? And put a little makeup on, or, if you're a male, make sure that you're shaven and good, that your hair looks good, that you take the time to pamper yourself a little
Right,
bit.
it's that self-love and that self-nourishment.
Exactly. So you take the best care of yourself that's possible and not go to the point where you stop taking care of yourself. Because that's one of the key signs, too. People stop
indifference.
taking, the hygiene part of themselves, and they're indifferent, and they really don't take care. So it's a combination of everything, isn't it? Well, we've had a wonderful show, and if anybody has any questions, be sure to contact us at info@ycdholistichealing.com.
The preceding program